The G. Paul Moore Lecture is always a major highlight of these symposia. The first was delivered in 1981 by G. Paul Moore. Paul was a father of speech-language pathology and of interdisciplinary collaboration. He worked with Hans van Leeuwen. He trained most of the people who trained most of the people who are in the United States practicing speech-language pathology. Nancy's bio you can read, but we can't neglect mentioning what she has done for the Voice Foundation. She is a keystone of our programs. She puts together every year a remarkable Friday morning special session. She's one of our best and most timely Journal of Voice reviewers, and I don't know what we would ever do without you, so don't ever let us find out. Nancy Solomon.
Thank you. I'm starting to wonder if it's Friday, because that's when I stand up here in the mornings, and not Saturday. So thank you, Dr. Sadloff. Being invited to give this coveted lecture is really quite an honor, and I'm humbled to be standing here before you, and grateful to the selection committee for that opportunity. So as I work for the federal government, I'm a research speech pathologist at Walter Reed National Military Medical Center, and so I need to tell you that the views I will be expressing today are my own, not those of the U.S. government or the Department of Defense. Any mistakes or omissions I make, please forgive me, but they are mine alone. I'm also grateful to the Voice Foundation to support getting me here for these meetings. So 15 years ago, Dr. Sadloff invited me to take a major role in symposium planning, like he said, and since then I've been developing and organizing, introducing and moderating the Friday morning special sessions. I'd like to talk to you today about the way I've approached this responsibility. My husband of 30 years, Jonathan, who's here today, is the clever one in our marriage, and he came up with this title for me, so I want to thank him for that. The Many Voices of Conducting Research. So, it is the many different disciplines in speech-language pathology that brought me to the field in the first place. As my bio indicates, you have in your program, I was kind of a nerdy teenager. I liked math and science, English grammar, music theory, but my passion was performing in my high school show choir and musicals in high school. It was the singing that I loved, but I had no idea it had anything to do with speech-language pathology. When I was a senior in high school, I was trying to pick my major for college. I had no idea what to do because I loved everything. And my sister-in-law-to-be at the time was a master's student in the speech-language pathology program, and she starts telling me about this field where you can, it includes English and physics and anatomy, and of course my favorite thing, talking. And so that was a perfect match for me, and I decided to major in speech-language pathology. My voice teacher was thrilled with my choice, but I really didn't understand why at the time. So I went off to college, starting on the very first day as a hearing and speech sciences major, which is what it was called at University of Maryland. And then I followed the expected track, getting my master's degree in speech-language pathology, doing my clinical fellowship in a medical rehab center, and immediately going back to school to get my PhD in hearing and speech and hearing sciences. So they're all different names, but as you know, it's all the same field. I realized that I just had to get out of the speech-language pathology box and learn some new skills. So I looked for a postdoc with a physiologist. That's what I wanted to do, and I found one, Eric Lushai. He was a physiologist in a speech pathology and audiology department. So pretty linear. I could not seem to get out of the field. But clearly, speech-language pathology is inherently diverse. And voice in particular is an inextricable part of many communication disorders, as you know. So as I progressed through my doctoral studies, I started to look outside of the speech science literature to really fully appreciate the voice and speech mechanisms. And I took courses and did research projects in physiology, kinesiology, and biomechanics, and neuroscience, and then have interacted with many, many fields Since then, it's just multiplied, and coming to meetings like this one helps us all expand in our knowledge and how we approach our work. So I've been given this awesome opportunity to take half a day of the meeting to really explore some topic in depth. And I've developed kind of a template for how to organize the session. So we pick a topic along with the planning committee, and we try to think of a topic that will appeal to this very diverse audience that we have. I like to start by bringing in a basic scientist or someone outside the field to teach us something we may not know, or to give us that basic background we really need. And then we'll bring in people that are doing research in the area to tell us about the current state of the art in the research. We bring in practitioners who've also usually done research in the area to give us evidence for what we do. And then, as you saw yesterday, we have an hour dedicated to question and answer, which I think is kind of unusual at a conference. And it gives you an opportunity to hear that experts haggle with each other, and also for you to get engaged in the discussion. And the ultimate goal, in my mind, is to stimulate research. So we want to get you thinking, get the juices flowing, so we'll do more work. If you've come to this symposium every year since 2006, like I have, this talk is going to be a trip down memory lane. But I also felt compelled to see if we actually are stimulating new research, so I've made an attempt. It's not a systematic review on 15 topics, but I have tried to update the literature. So I looked at the last 2 or 3 years of what's happening to see, where we've come. So hopefully you'll learn something new today in addition to reminiscing with me. So I am going to go through our topics. I grouped them into 5 themes to help it be organized. Just for fun, on each of the main theme slides, I've punctuated them with a vintage picture of me. Why not? and as you see, as we work through the sessions, I've listed all the speakers, and I've also listed the disciplines they came from. So you can see all the different fields that are involved in our interest in the voice. Because I have a time limit, I'm not going to be able to mention every speaker by name, but I want you to know, and many of you are in this room, how grateful I am to you for accepting my invitation to come talk and really make this special event what it is. So this talk really is by you. So let's start with the assessment of the voice. There were 3 topics, 3 years that we covered themes related to that. And you can see I learned how to assess the voice. In this case, I was actually doing some chest wall kinematics work during my PhD with Tom Hickson at the University of Arizona. So here's our themes. We're going to start with the theme of visualizing the larynx. The year before I started planning these sessions, Dr. Ron Bacon had planned a session on auditory perception, and he called it, "Hear ye, do you hear what I hear?" And so the next year we did visual perception, and we called it, "Do you see what I see?" So, in addition to our wonderful speech-language pathology colleagues, we had 2 presenters from outside of the voice specialties. John Krantz, who came from psychology and does work on visual perception, and Charles Stegman, who is a fine arts educator. Dr. Krantz published his talk in Journal of Voice 2008, so I always assign it to my students. It's really a wonderful overview of visual perception, optical illusions, artifacts in the visual image, really great. Dr. Stegman is like I said, a fine arts educator, and he took us on a journey on ways to look at and interpret images, presumably of the larynx, but he used art as his medium, and it was a really beautiful lecture. Now, clearly we know that we've come a long way in laryngeal imaging since Garcia's mirror and oil lamp, as Dr. Nimi beautifully reviewed during the Quintana lecture on Thursday. And you can see here, I had to show you a picture that I had of G. Paul Moore, von Leyden, and Timke in the 50s using cinematography. And I just chose one article to bring us up to date on the clinical application of voice assessment. This article was published in 2016 by Bruce Paborka, Rita Patel, and Diane Bless in Journal of Voice. And it updates Paborka's well-known and well-used video stroboscopy rating form from 1999. This is just a portion of the form, but it incorporates both the video stroboscopic images as well as high-speed laryngeal imaging so that you can use the best of both in order to make your best clinically feasible laryngeal exam. So that's my update on that topic for you. You see, we're going to go quickly here. A couple years later, we had a session that explored state-of-the-art approaches for diagnosing voice disorders, and this topic was the brainchild of Dr. Janina Kasper, who happened to be my CF supervisor. She unfortunately had passed away just shortly before the symposium, and Dr. Diane Bless stepped up to fill that void just beautifully. Ron Bacon and Jan Schweck spoke about instrumentation for voice disorders, and we had 2 ENT-SLP teams present cases. So it might appear that we didn't have an interdisciplinary focus that year, but think again. We definitely include Dr. Jan Schweck as one of our own, but did you know that his first PhD is in biophysics? And then he got a second PhD in medical sciences, so even though he's clearly one of ours, he comes from another field, which is really what propels our field forward, and it's just amazing the work he's done, and I wanted to highlight that. So he developed the use of video chymography to examine vocal fold vibration, and here's citations from a couple of his papers, recent papers. We heard some beautiful talks on Thursday morning about vocal fold imaging, about diffuser tensor imaging, magnetic resonance imaging, high-speed endoscopy with laser point calibration, laryngotopography, and multi-line digital chymography. So there are lots of wonderful techniques. And this is, though, maybe we're getting to the point where we'll be using these in a clinical setting. Video stroboscopy is still obviously most commonly used, but the adjunctive use of high-speed endoscopy and video chymography really is now a clinical reality. And finally, under the topic of assessment, we had a specialized topic. We had a session on voice forensics. And Dr. Harry Holeen, who had to tune in remotely, but he gave a really wonderful talk. He's the original scholar on voice forensics. And he spoke to us about speaker identification using speech and voice. We had the 3 speech science speakers you see here wrote up their papers, and they are available in Journal of Voice 2014. And Dr. Holeen published a recent proceedings, 2016, with some standards for using voice and speech to identify speakers. Our outside of the field expert was Malcolm Brenner. Dr. Brenner was trained in psychology and social psychology, and he developed a specialty in speech analysis and human stress testing because he was interested in stage fright. And really accidentally, he found his way into forensic analysis and became known as an expert pretty quickly. And Dr. Brenner, you might remember, told us about real accident investigations from the National Transportation Safety Board, including the 1989 Exxon Valdez accident and U.S. Air Flight 427 crash in 1994, where the voice forensics experts, which was him and his team, analyzed speech and breathing noises to decide whether the captain of the ship and the pilot of the plane were impaired. At the time of that symposium, we were all enamored with the case of Trayvon Martin and George Zimmerman. You might remember, even Dr. Drew weighed in. And the forensic voice expert examined spectrograms to decide if the voice saying stop or help was George Zimmerman's or Trayvon Martin's. And I love one of their conclusions is that the specialist said that they could determine the owner of the voice with a reasonable scientific certainty, which then, of course, was interpreted to mean it was not 100% accurate. So there you go, that's how you can interpret science when you want to. Now since then, so to give you an update, I had fun reading some of this literature. There have been some really exciting efforts to improve speech automatic recognition algorithms and statistical analyses for forensics. Much of that work comes from a Dr. Jeffrey Morrison, who I don't know, but he's from the University of Ashton in Birmingham, England. I was curious, I saw he was trained in linguistics and engineering and theology. So lots of fields come together. So his research demonstrates that using automated approaches to forensic voice and speech analysis over acoustic phonetic statistical approaches is preferred. And that's because the acoustic and phonetic statistical approaches generally include human input. This example is from the 2018 article where they were trying to separate the voices of two sisters, and they were recorded over a cell phone because that's how the crime occurred. You'll have to read the paper to see what came up with the crime investigation, but they used different statistical analyses to analyze the speech. And the pictures on the bottom show you the first and the fourth methods of analyzing the speech. And you can see that methods are getting better for separating out the voices, but they're not perfect. So any automated analysis is going to overstate the strength of the evidence. Okay, so theme 1. Theme 2 is breathing and phonating for speech. The topics in this theme involve breathing for speech and public speaking. And here I am giving one of my very first public speeches sometime in elementary school. I have no idea why or when. Do you see the microphone? It's all over. So you might know that my dissertation work was on speech breathing in people with Parkinson's disease. So having a topic on speech breathing was near and dear to my heart. Dr. John Cohn opened the session by sharing a pulmonologist's perspective on respiratory function for the voice professional. Dr. Christine Sapienza talked about her body of work on respiratory strength training, and Dr. Brenda Smith spoke about the pedagogy of breathing for singing and acting. And then we had a panel of young investigators who challenged us to look forward to the future for the study of the competing and complementary demands of the respiratory system and the phonatory system for speech. Like the dissertation work of Dr. Amanda Gillespie, she studied laryngeal responses to breathing challenges. So she created breathing conditions that resulted in normal, low, and high levels of arterial carbon dioxide, and found that laryngeal airway resistance and the vocal intensity were maintained. So in other words, people would maintain the goal of what the larynx is supposed to do, even though the respiratory system was really compromised. Another study that looked at the codependence of breathing and phonation was by Heller Murray and colleagues, and they found that lung volume levels vary predictably when people spoke in a normal voice or a breathy voice. So together, these studies demonstrate that changes in one system will produce systematic changes in the other, with the ultimate goal of maintaining phonation. Our 2009 session on public speaking included 2 expert speech-language pathologists who specialize in voice and speech coaching for public speaking. Our interdisciplinary outsider was Deborah Rosen. She's a licensed psychologist and a registered nurse. And she gave a really captivating presentation on the psychology of public speaking and performance anxiety. And then our discussants came from different aspects of our ranks here. So there are a lot of papers in the literature these days on performance anxiety, mostly because of the increase in anxiety disorders in school-aged children, students, teenagers, and young adults. But that literature generally focuses on medication, exercise, Sorry, I shouldn't touch this. If you want to continue guiding me, I would appreciate that. So next. Sorry. That literature focuses on medication, exercise, and relaxation. There we go. There have been some recent advances in the research on autonomic nervous system influence on laryngeal reactions to stress. And for this, I'd like to highlight the dissertation work of Dr. Leah Halou, where she looked at respiratory and laryngeal responses to a psychological stressor. So in this case, they had young women, there were several conditions, but the 2 that are demonstrated in these figures here, the control condition is just imagine while you're hooked up to equipment, that you are telling a small group of friends about your dream job for 3 minutes. And then the stress-inducing condition was to, without any notice, okay, you have 3 minutes to prepare a speech that's going to be a job interview, like a job interview, and you're going to be observed by experts in nonverbal communication. So it was a very stressful public speaking preparation condition. They didn't actually talk and they didn't actually give the speech they prepared, although they didn't know that at the time. And what they found is that breathing changed Heart rate increased, breathing rate increased, and the breathing became a little irregular. There was breath holding, there were big sighs, and so, breathing was affected. Laryngeal function was affected for about 2/3 of the subjects, where electromyographic activity increased when they were preparing the speech compared to when they thought about talking to some friends. Interesting work, and I'm happy to see us getting into the physiology of it. In 2016, we focused on truly exceptional and extreme use of the speaking voice. Dr. Mauro Balao reviewed the literature from a speech-language pathology perspective. And then we had Mr. Michael Sheehan, who it seems like he's from within our ranks, but does not normally attend this meeting. He was trained as an actor, but he really ended up having an uncanny knack for coaching corporate and political speakers. He shared some of his special techniques about conveying the most effective message. And then Dr. Bonnie Raphael, who we all know and love, the acting coach and retired professor of theater, shared her personal experiences over the years coaching people with extreme and potentially damaging vocal needs, like Shakespearean actors performing outdoors, or video game vocal sound effects artists, or voiceover actors. And then we heard really inspiring and fun real-life stories from 3 panelists: a news reporter, a motivational speaker, and a voiceover artist. So I was looking at the recent literature to bring us up to date on speaking and acting voice, and noticed that there was a bit of a theme about education. What happens when you provide education? So these 4 papers from Journal of Voice is just a brief survey of some of those. First, very recently, Flynn conducted a survey with over 350 respondents. They were recent performing arts graduates, and she surveyed how their voices were doing and whether they sought any help, and found that singers received more education in their undergraduate programs about vocal hygiene and voice use than actors. Not too surprising, but that actors were more likely to run into voice problems, and when they do, they were more likely to seek medical help than singers. Korza and Sezin in 2018 provided 12 weekly training sessions to a small group of theater majors, and found that their knowledge of the voice and vocal function increased compared to people who didn't learn about it. That's not too surprising. It's kind of just before and after you go to school, you learn something. So, but we don't know the long-term effects. Rodero and colleagues published, this is kind of interesting, they published a 30-hour vocal training program for future journalists. And that paper included feasibility data, efficacy data, and it showed improvement across a variety of measures. The last study listed here by Rangan Rathnam and colleagues didn't do training, but they asked people whether they were trained. They followed a group of Shakespearean theater actors who were involved in an outdoor theater festival for a month, doing very intensive rehearsals and performances to see how they did. And they found that, yes, their voices deteriorated over that month, but that their report of their own vocal hygiene and vocal training had no relationship to who was going to have voice problems and who didn't. So we really have no idea if this training works. We don't, but we need to know. So going to provide training, we hope it makes a difference. So please do the research. The next theme is that of managing the injured voice. Now we know voices can be injured, obviously, but what innovations are there in healing these complex tissues? So we looked at wound healing and voice rest, we looked at genetics, and because we looked at genetics, I had to throw up a picture of my older brother performing with me when I was 16. And then we talked about remote therapy. So, all right, first we explored issues related to wound healing and voice rest. The basic scientist for this session was Dr. Patricia Hebda. She was in the Department of Otolaryngology and Cell Biology and Physiology, and taught us about processes involved in tissue inflammation, healing, and scarring. Our other invited speakers came from speech-language pathology and experimental psychology. I am sure you know them both well. And I'm going to actually talk about more of that work in a moment, but if you'll indulge me for a second, I would like to talk about my interest in voice rest, which is where the topic came from in the first place. So when I was in high school, I had sung in one too many choirs, and it took a toll on my young, classically trained voice. I went to an otolaryngologist, a lovely, somewhat elderly, well-intentioned man, who diagnosed young nodules and prescribed complete voice rest for 3 weeks. At the time, I was actually a camp counselor for 3-year-olds. I wasn't your most compliant patient. So his specific instructions were to avoid talking, singing, coughing, and even whispering. And it was that prescription, the whispering one, that really got me thinking, because I was a freshman in college, I was learning about voice, and I knew that vocal folds don't vibrate during whispering. Why can't we whisper? And that is what made me come up with my master's thesis topic, which was actually the first talk I ever gave at the Voice Foundation. So this topic. And it dealt with laryngeal configuration during whispering. I only studied 10 people, they all had normal voices, but we looked at the larynx and we had them whisper with low effort or high effort, so kind of quiet and loud. And we were able to demonstrate that about half of them didn't have any vocal fold contact anyway when they whispered, the other half did. And there was no supraglottic constriction during whispering. And just looking at the literature, nearly 20 years later, Dr. Adam Rubin and his colleagues took on this question by examining 100 patients. This was a retrospective study, but they had their patients whisper while they were being scoped and looked at vocal fold contact and supraglottic constriction in people that had hyperfunctional voice disorders, and found that 86% of them did have vocal fold contact and 69% exhibited supraglottic constriction. So I'm very grateful to them for updating us on this topic. We still don't know, there is no vibration, so that is still a question, but there is contact in most people. Now in 2003, Behrman and Silica surveyed ENTs and reported that about half recommended complete voice rest following microsurgery. So this is post-surgical patients, not people like me who didn't have surgery to treat my young polyps, my young nodules. So they had nodules, polyps, and cysts removed, and most of the ENTs recommended 7 days of voice rest and no more than 3 weeks. 15 years later, Yoshi and John surveyed a smaller group of laryngologists who specialize in voice and found that all but one recommended at least some complete voice rest after microsurgery. So the typical duration was still 7 days, and the reason that so many more of them probably recommended the complete voice rest is maybe because they specialize in voice and weren't general otolaryngologists, or maybe it's because of what we've learned about wound healing. So there's a review by Ishikawa and Tebow in 2010 that lets us know that we now know that fibroblasts of the extracellular matrix proliferate approximately 3 days after surgery. And inflammation lasts for about 1 week. So we don't know exactly when to start the voice rest, but the timing and the manner of recovery probably does work to avoid vocal fold scarring, which of course is the goal. They came to the tentative conclusion that voice rest, especially early after microsurgery, is probably helpful to facilitate wound healing, better than uncontrolled phonation. But the question about how long the voice rest should be, we still don't know. So I don't know if you saw it, but just last week, I had to put this on here. Just last week, where is he? Oh, I'm sorry. Does it not come out? Yeah. Just last week, Trevor Noah, the comedian and talk show host, did a stand-up bit, I saw it posted on YouTube, where he said that he had a hemorrhagic polyp surgically removed from his vocal folds, and his laryngologist put him on complete voice rest for 1 week before the surgery and 1 entire month afterwards. I don't think that's common. I think that is probably not indicated, as Dr. Sadloff has in his books. You know, this can perhaps encourage atrophy of vocal folds, but he thought this was the right thing, and you really should watch this though too, because he does a fantastically funny bit about confidential voice that you have to watch. I'm definitely showing it to my voice class when I teach next year. It's really funny. Okay, I love Trevor Noah, but I don't know if I like this doctor's advice. So the question is, how long should voice rest be? And I found one study of a randomized clinical trial. It's small, but it's randomized, where Kaneko and his colleagues examined this issue by assigning post-surgical patients, again, these are all microsurgery, patients to 3 or 7 days, a complete voice rest. And for every measure they took, the 3-day outcome was better than the 7-day outcome when they analyzed it like 1 month, 3 months, and 6 months later. These figures are from the 6-month data. So maybe, you know, starting to talk again after that 3rd day is going to promote healing. We really don't know. But no studies I can find really have looked at the issue of voice rest in people who don't need surgery. So that is open for question, unless I missed it, which could have happened. Now, recent work by Dr. Susan Tebow is addressing, this work is brilliant. I'm going to try to distill it down for you. Really hard to read, but beautiful work. She and her group addressed genetic markers and biomechanical properties of the vocal folds. And as I mentioned earlier, she was trained in speech-language pathology. This blows my mind. She went on and learned all of these wonderful techniques. So let's see, this is a figure from a brand new study, just came out last month, that shows clustering of genes in the vocal folds as compared to the lung, for example, in this figure, but they also looked at other parts of the body. And the study clearly showed topographic differentiation, and the vocal fold specific fibroblasts show mechanical advantages for vocal fold vibration. Now, other studies are specific to vocal fold scarring and are focused on cell-based therapies. This first one, also by Dr. Tebow's group, Mark Bartlett et al., they studied mesenchymal stromal cells from bone marrow in a vibratory strain bioreactor and with microarray analysis, and compared it to fat cells as the control, and showed that the mesenchymal stromal cells show similar wound healing potential as the vocal fold fibroblasts. New research by Kiwatashi, listed second here, has demonstrated the potential for RNA-based therapies to direct wound healing. So these authors are starting to make some pretty bold statements and really exciting statements that cell-based therapies and RNA-based therapies may actually become clinically feasible for wound healing. It's really exciting work. In 2011, we invited Dr. Barry Bittman. He's a neurologist, and he's also a researcher, a producer, inventor. He's kind of a big thinker. He came to talk to us about transcending boundaries for making music and treating patients. He teamed with Dr. Michael Benninger, who's an otolaryngologist and a frequent contributor here. We all know Dr. Benninger. And also Dr. Neil Cherian from the Cleveland Clinic, who tuned in remotely for this session. Which kind of was the point of the session. And so that was perfect. They showed us how to do laryngoscopic examination using remote technologies. As a bonus illustration during that year, if you came, I'm sure you remember, is Dr. Bittman brought this internet-connected Yamaha grand piano, which he set up over here. And the pianist was in California playing that piano, and we were watching the pianist. And so that doesn't seem so cool now because we've seen that before, I think. But then it was very, very new, only a couple years out of its original technology. We were also treated to a beautiful vocal performance by accomplished opera singer Charity Tilleman-Dick, who was also known as Charity Sunshine. And what was remarkable about her performance is she had had a lung transplant because of a rare progressive illness called idiopathic pulmonary hypertension, and she's since had a second lung transplant. Sadly, you may have seen on the Voice Foundation Facebook page, Charity succumbed to her illness just last month when she was 35 years old. But I have this video from the Cleveland Clinic I'd like to play just a little bit of, so we can hear from her cardiothoracic surgeon, again, another field, another discipline that contributes to what we do, and from Charity herself. So the video will play.
As a second chance.
It is hard not to become emotional. You know, that's to say our passion. Her passion is to sing. Our passion is to have patients like her sing.
To be able to come back to say thank you and to sing for the first time for an audience that I knew was rooting for me and that I knew understood just meant so much. I think it was probably the most important performance of my life.
Just a second chance. Okay, so rest the next group of sessions, which I am calling Everyone Has a Voice. We covered topics ranging from singing in children, so I selected a photo of me singing a solo as a teenager in a school choir, to voice changes in aging adults. We covered congenital amusia and transgender voice and communication. There's a theme running through these sessions, and that's one of cultural competence, learning the appropriate language to use and issues to consider when working with specific populations. In 2013, we didn't really focus on the voice. We explored the psychosocial and cognitive benefits to singing and performing. We brought in people from totally different fields who all converged on the notion that singing and performing in groups nurtures children in so many ways. Vi Higginson was a speaker that had never been here before. She began her career as a magazine advertising executive and editor, and went on to be a radio host and theater playwright and producer. She delivered a beautiful story about her desire to bring gospel music back to the children of Harlem, New York, because she noticed that gospel was just disappearing in favor of hip-hop and rap. But what she really ended up doing wasn't just exposing children to gospel music. She created a community. It was like a home for lost and disenfranchised children. And if you attended the gala that year, you probably remember the exciting and inspiring performance by her Gospel for Teens program. This picture's not from that, but it's in that same time period. And then we heard from Mr. Aaron Feinstein. He's the director, was the director of the Miracle Project in New York City, which is a project that, an organization that works on expression using voice and theater in children on the autism spectrum. This amazing program is still going strong and really helps people of all ages. So here's a sample of some recent studies to bring us up to date related to this topic. Claros et al. Just this year examined nearly 1,500 school children. And when I say examined, literally examined the larynxes of 1,500 school children, half of whom were in choirs and half of whom were not. And the ones who were not in choir were twice as likely to develop functional voice disorders than those who were. Twice as likely, 32% versus 16%. Also, music therapy is common in hospital settings. This recent study from the University of Salzburg took saliva samples and psychological inventories from 11 to 18-year-olds who were hospitalized with mental health issues. After 1 week of daily sessions, children who participated in a singing group had increased their quality of life reporting and decreased in cortisol, the stress hormone. Some students also listened to music and they also benefited. And children on the autism spectrum also have been in singing group programs. They're pretty small samples, but they are showing that children on the autism spectrum respond better to words that are sung rather than words that are spoken. And the study by Sharda et al. Demonstrated increased frontotemporal connectivity using DTI and fMRI, which when they listen to passively sung words or piano tones rather than spoken words. In 2015, we pulled in the other end of the lifespan. We invited 5 speakers who all specialized in gerontology in one way or another. 2 of the speakers came from fields other than speech-language pathology and otolaryngology. Dr. Christian Sell shared with us his current research on basic cellular level mechanisms of aging and how they increase a person's vulnerability to various diseases and disorders that can affect the airways, the lower, upper, and laryngeal airways. And Dr. Sarah Kagan is a registered nurse. She helped us become competent in the language of the elderly population and issues that are important to them. At the bottom of the slide, I've listed 3 recent review articles on the aging voice. This is a growing topic to help us all stay up to date. I'd like to point out just a couple of studies myself. The first one is about new assessment tools that have been developed. The first one was developed in Brazil as a screening tool. And the second one is by Nicole Eder along with Dr. Hapner and colleagues. And this article is in Press and Journal of Voice. It lays out the careful development and strong psychometric properties of the Aging Voice Index. Creech, this last one, recently published a systematic review, so this has a lot of studies in it. And it's interesting, they have this word gerund technology, which I hadn't heard before. It's about using technology to bring music to seniors. And that's the whole article is about different studies that have looked at that. There are not very many studies, but the results are encouraging that elders, even people with dementia, are able to interact with simple technology to access music. And they can create music and even do sing-alongs. And so they reported lots of benefits, similar to benefits from other studies looking at group singing. There's a study by Lorty et al. That just last year that examined people from the ages of 20 to 93 and showed that people who report frequent singing, and this is daily singing, can maintain vocal stability more than people who sing less frequently or not at all. And group singing, we talked about group singing in children. Group singing in adults is extremely beneficial, not just elderly, but all adults. This first study surveyed nearly 1,800 people online who sing in choirs, so they're self-selected, and they were thrilled that they sing in choirs, overwhelmingly positive results. Women in particular, more than men, claim to benefit physically, socially, and emotionally from singing in groups regularly. Muller et al. Used network typology measures to determine that singers actually entrain their cardiac, respiratory, and phonatory rhythms. And this sort of social and physiological synergy is thought to yield psychological and emotional well-being in people. Women with and without physical and mental health issues showed benefits from group singing. And finally, not only did chronic obstructive pulmonary disease improve after 24 weeks of singing in groups, but also their emotional, their depression and anxiety got better. Okay, now, congenital amusia. I was actually going to talk a lot about that, but we had our keynote speaker on Thursday who talked about pitch, so I can skip some of it. You'll recognize this picture of Dr. Stephen Brown if you heard Dr. Ford Drescher's keynote address Thursday. We were fortunate to have Dr. Brown here to speak about his research on the role of the human brain on producing and perceiving pitch. Dr. Jessica Phillips-Silver has the degrees listed here, but also did a postdoc with Dr. Isabel Perez, who was also mentioned on Thursday. And Jessica's a dancer, so she looked at the rhythm of music and whether that can help people with the pitch of music. And the session wrapped up with Mr. Dan Belmondo, a vocal music educator at high school and a conductor of vocal ensembles. He taught us about music literacy using an approach called music learning sequence. So in addition to the beautiful literature review we heard on Thursday, there are a couple of recent papers that are worth highlighting. One of them is from the lab of Isabel Perez, and I think their most important finding lately is correcting a misconception. There's the idea that 4% of the population has congenital amusia based on an old study, and they did an evaluation of 20,000 people using 3 different tests and a questionnaire, and found that only 1.4% of people using their criteria actually have congenital amusia. So it's pretty rare. When it happens, it's slightly more likely in women. Females, it is hereditary, probably, and not affected by musical training. You can't train out of these people that truly are amusing. The study by Wong et al., they used DTI analysis, and they demonstrated that amusia is a disconnection syndrome. So overall, people with amusia had less efficient brain networks than normal listeners, normal singers and listeners. Okay, one more topic, which is actually, one more topic under this theme of Voice for Everyone was on transgender voice. We brought in Dr. Wiley Hembry. He's an endocrinologist, and his undergraduate degree, by the way, was in philosophy. He led us through the endocrinologic issues related to children, teens, and adults with gender dysphoria, and discussed the timing and the options for various hormonal treatments. Our very own Dr. Sadlaw spoke to us about surgical options, and then we had 3 experts from speech-language pathology covering issues related to assessment, treatment goals, and future directions for research, clinical and scientific research. So this topic is gaining quite a bit of attention in the past few years, and I just started going through the literature and listing, and several of these are review papers, so there's really a lot. First, I want to just point out that the Transsexual Voice Questionnaire, male to female, by Dukakis, Davies, Oates, and others, has been translated now into 13 languages, and there are plans for more, and there are several new validation studies. Generally, I'm just going to summarize what I learned from reading this sort of skimming through this literature, and that's that voice therapy alone usually yields satisfactory results. Patients are happy with it, about 80% report satisfaction. But some people still want a higher pitch, and if their desire and their financial means allow, they may undergo a surgical procedure, and the literature seems to indicate that shortening of the endoscopic shortening of the vocal folds was the most successful of the choices. Although we learned from Dr. Claudio Stork on Thursday, if you were here for his talk, that cricothyroid approximation is likely to give successful results if patients are screened carefully for the type of cricothyroid joint. Our last theme is promoting a healthy voice, and for this theme, we only have done this last year and this year, so I don't have much literature to update, which is good because I have 3 minutes left. So I don't have that, but I do want to acknowledge our speakers and once again show that the topic was approached from a multidisciplinary perspective. But to point out, to promote my own wellness in many ways, I've gotten back to singing in an a cappella group. This photo was taken about 4 years ago when my daughter Rachel, who is also here, was performing with our group. So she's next to me. So last year we focused on issues related to exercise, from the physiologic benefits to the vocal pedagogy approaches, and on yoga, where we actually did some body practice and awareness in the session. And this year, you just heard this yesterday, so I don't need to tell you again, but we talked about the mind-body wellness approach to voice management using complementary procedures and techniques. So as you can see, we at this symposium embrace and crave multidisciplinary research. I am no exception, as I've reached out to other specialties over the course of my career. I've selected a few examples just to prove that I practice what I preach. So, as I mentioned before, I've worked with physiologists during my postdoc to understand the respiratory and laryngeal interactions in an animal model. I worked with laryngologists and histologists to compare laryngeal and electromyographic techniques. I've paired up with neurologists and neurosurgeons to study the impact of deep brain stimulation on speech in people with Parkinson's disease. I collaborated with a linguist and a neurologist to study the effects of fatigue on speech in people with Parkinson's disease. I teamed with surgical oncologists, laryngologists, and statisticians on a series of studies on the sequela of thyroid surgery on voice. I've had the opportunity to work with mechanical engineers and bioengineers for innovative technologies to study respiratory resistance. And in a multi-year study on swallowing disorders in the military, I worked closely with anatomists and statisticians to understand the biomechanics of swallowing and predictive modeling, predictive analytics of this multidisciplinary problem. And clearly I've worked with many outstanding speech scientists, speech-language pathologists who have kept all of this work clinically relevant and better than I could do by myself. So I want to thank the Voice Foundation. I love the interdisciplinary nature of this symposium, and it's been my honor to bring you sessions that follow this passion. It's been a wonderful journey for me, and hopefully for all of you, during these past 15 years. I want to thank you for allowing me to serve at the helm of this endeavor, or actually more accurately off to the side, as I stand there as moderator in your panels, and I hope to continue doing it as long as you'll let me. Thank you.